home and being safe. So I have muted everybody, just so you know. So if you're trying to talk at all, I would use the chat. And then at the end, we'll have a Q&A session where people can raise their hands, which is one of the features on there. And we'll kind of call out names, or even if you just want to do it in the chat, that's fine. But I'm mostly going to keep everyone muted just so we don't get excess noise at all.
Are on it with their pictures. See, I'm glad I'm not a picture.
And then, so again, thank you all for joining us. We really appreciate you guys coming in. We really appreciate you kind of going with us as we figure this out on our own too. So let us know if anything's not working in the chat. If you can't hear somebody, we'll try our best to troubleshoot as we're going. First, we're going to have Michelle talking about all of the new impacts that the COVID-19 pandemic has had on PT and, you know, specifically within Rhode Island and all that.
Well, thank you, Erin. I think what you may have witnessed, I'm not sure if people could see, is that while you were doing your wonderful introduction, what you discovered is what our lives sort of consist of at the moment, which was while we're either in a telehealth visit or a meeting or meant to be speaking, something like normal happens, such as your dog start barking at someone going through the gate and you're yelling at them and cursing them. And so there's all sorts of different stories like that going on at the moment. And I just got busted in the middle of one. So I'm not sure if people saw that, but you know, sorry about that. Anyway, thank you so much. It's really nice to be here, and really nice to be here for the students as well. It's a challenging time for everyone. And although the theme of tonight's meeting and presentation is about advocacy, I think that given what we're dealing with this COVID crisis, it highlights really how amazing advocacy is and how important it is and the impact that it has on our profession and our patients. So I wanted to start off with tonight giving you guys some real life evidence of the impact that advocacy has, and I really hope that inspires you and realize what a difference grassroots advocacy makes. So just to give you a little bit of history, here we go. Come on, slideshow. Here we go. So we're going to talk about coronavirus. So obviously the virus started impacting Rhode Island early in March, and that's when many of us, whether we're in outpatient, hospital, home care, pediatrics, started seeing some changes with our state, some increased awareness of the health concerns that actually happened more in February. But in March, as we really saw it having a significant impact on our communities. And so a profounding thing that happened on March 18th is our Governor Gina Raimondo, actually passed what you call an executive order. And she worked closely with with OHIC, which is the Office of the Health Insurance Commissioner. So in different states, these are called different names. In Rhode Island, it's called OHIC. It's the Office of Health Insurance, the Health Insurance Commissioner. In other states, you hear it called different things. But this office role is to really make sure people are getting access to care, and they really are there to monitor and oversee what the insurance companies or payers are doing. So they're the ones who oversee, can an insurance company charge more premiums? And if so, how much will that impact people's access to care? So when it comes to advocacy, the OHIC is actually someone who actually helps us significantly. So coming back to this March 18th date was quite profound because Governor Raimondo passed this executive order, which meant that telehealth services, meaning both video conferencing and phone calls, needed to be paid for and reimbursed and treated exactly the same as what in-clinic or in-hospital or in-home visits, how they were paid. Wow. So it was a pretty aggressive move for Rhode Island. We were sort of far ahead of many other states, which was a wonderful thing for our state. So this happened, and what this meant is now we were in a position where we really needed to advocate and ensure that our payers were following this executive order. Now it sounds a simple thing, yay, the governor passed this executive order, so suddenly everyone gets paid for telehealth services, whether you're outpatient, private practice, pediatrics, school-based, home care. Unfortunately, it doesn't work that way. That's when we really have to work on our advocacy side of things. So we worked with our lobbyist, we worked with the National Association, we worked with a national COVID task force that I was lucky enough to be part of. And based on this information, we then had to go after our payers and say, hey, this executive order was passed. What are you going to do about it? How are you going to deal with it? This slide here really just gives you some ideas about that. Sorry, the Office of Healthcare and the Health Insurance Commissioner. So this just gives you an idea of some of what we call the payers. And again, what we're really talking about from an advocacy standpoint is not to do with payment and how much we should be paid. It's all to do with access to care. So given the public health crisis that's going on through COVID and the fact that we want to protect this and limit the spread of this, for many patients, they were either in quarantine, it wasn't safe for them to go out. So therefore, we still need to provide access to care. So that's what the whole telehealth thing was about. So when it comes to advocacy, there's a number of levels that we had to deal with. We had to deal with what we call our local payers. And our local payers are Blue Cross Blue Shield of Rhode Island. We have a great working relationship with them. So there was many hours spent on the call discussing what telehealth was, how would we execute it, what should be, are the codes the same? So a lot of the advocacy work we were doing was actually educating the payers as to what it was. Another big part of advocacy was actually educating patients, because many patients didn't understand what it was. And again, depending on the setting that we were in, I heard many stories from school-based therapists having to just educate parents about what telehealth was, from those in outpatient and private practice having to explain to their employers, to their patients, from those in hospital systems having to educate administrators. So a lot of education for us to be able to articulate and advocate why telehealth and the opportunity to provide this was necessary to ensure that people continued to have access to physical therapy services. Because through all of this, physical therapy is defined as an essential service. We are expected to be providing service, so we want to make sure we can do everything we can so that people have access to care. So we worked hard with Blue Cross, with Neighborhood, and because they're local, they're much easier to work with. Now, when it came to national payers, and our national payers, the big ones that we have here in Rhode Island, United, Aetna, Cigna, these are a little different to work with because they're under national policies and they're a little harder to advocate too. So you call them and you say, hey, guess what? Our governor put in this executive order that anyone in Rhode Island needs to have access to telehealth services given this crisis that's going on. And many of them respond by saying, well, that's not our policy. There's nothing you can do. So again, this is where we have to take these multifaceted approaches to advocacy. It's not a simple phone call saying, guess what our healthcare commissioner and our governor said, you have to do this. This means that we have to start getting patients involved. We work with national APTA, we work with different sections of the APTA. And at this stage, we actually have got United Health, Aetna, Cigna, are all paying for telehealth. Not quite the same as what Blue Cross and Neighborhood are, but at least providing it at certain levels. So you can think of, you have your local payers and you have to advocate to them. You've got your national payers. And then of course, we've got the tough one. And believe it or not, that's CMS. And that report, that's under the Department of Health and Human Services. So as you're probably all aware of, you've all heard of this CARES Act that was passed on March 27th. And the CARES Act was passed through Congress, and in it actually gave CMS the ability to expand its services. Now with that, we were all, first of all, excited to say now that our Medicare beneficiaries could now have access to care for telehealth when it wasn't appropriate for many reasons for them to go to a clinic or be seen in a hospital setting or have home care. However, Medicare does not consider physical therapists as being eligible to provide telehealth services. So despite Medicare even ultimately saying, yes, we'll pay the codes, they still are yet to say physical therapists are allowed to bill for them because they don't see us as eligible. So it's this really tricky situation. And when it comes to federal advocacy, now is a really, really impactful time. And I'm super excited to be even speaking to you, all of you here now, because now I think is a critical moment of where we're actually going to change the future of what and who we are as professions. So I actually have been in touch with both Senator Reid and Senator Whitehouse, because at this stage, Congress has passed this bill to CMS and the Department of HHS to say, yeah, we're fine with you expanding services, but what we need CMS is to do is to push through this blanket waiver that would say, yes, physical therapists are considered eligible providers to provide telehealth, because at this time we are not. Now you hear people saying we are, and what did happen is physical therapists were passed a waiver to provide something called e-visits, but e-visits is not telehealth. E-visits is just a kind of like a check-in phone call for existing patients. It does not transfer, it is not telehealth. And that's created a lot of confusion in our profession and amongst payers, because they've said, well, you have e-visits, that's what telehealth is, but it's not. It's very different. It's billed different. Again, impacts that access to care. So we're at a critical time now, and I actually have something for you all to do tomorrow, believe it or not, and that is to contact Senator Whitehouse and Senator Reid. Now, the nice thing for us in Rhode Island are these are two very respected politicians and very respected members of Congress, and also big supporters of physical therapy. So at this stage, we can change what happens in our profession right now by having Senator Reid and Senator Whitehouse call CMS and simply asking them to sign this waiver that will allow us to provide telehealth services to Medicare beneficiaries. Because at the moment, this population of people who are probably the most in need of our services, and it's the most important because of the coronavirus, that they stay in quarantine and stay home or away from other people, are the ones that are not getting the care they need. And we all understand that if they're not, it increases their chances of falling, it increases their chances of pain and other ailments and disease processes that will significantly increase the cost downstream and their chances of ending up in a hospital or medication or other interventions. So as I mentioned, at the moment, because of the coronavirus, there's a lot going on at both Senator Whitehouse and Reid's office. But Senator Whitehouse, I called his office yesterday, and you simply call and say, this is who I am. My name's Michelle Colley. I'm a physical therapist, and I have concerns because we can't take care of our Medicare population, especially since our governor has passed this executive order that payers cover these costs. However, CMS won't. And would you call CMS and ask them to sign this blanket waiver? Same with Senator Reid. He's not taking phone calls, but but you can enter your information via email. And I did it yesterday, and literally an hour ago, I got a response from a staffer. Now, what I noticed of that, and I've actually put it in this presentation, that he states that it's important we continue to hear from Rhode Islanders during this difficult time, and I appreciate you sharing your experience. To me, that is an absolute invitation for every single physical therapist, every single student, every single assistant, and any person or patient living in Rhode Island to call Senator or email Senator Reid and call Senator Whitehouse's office. The more people they hear from, it makes a difference. And they're super busy, but we just need them to pick up the phone and call CMS and say, please sign this waiver. And that allows our patients to suddenly have access to care. And it's really important. So just to finish off, I just think this is a fun little...
Hi, my name's Keith Hudson. I'm now over 80, so I'm a little less mobile than I was. I very much appreciate my time with my physical therapist, Megan, to help me overcome some gait issues and balance issues. It was very good. It'd be wonderful if I could continue with telehealth with my PT to review and improve the precision and repetitions of what I should be doing. in the exercises that we had worked with, particularly in light of the current situations where you can't get out at all. To be able to do this by, continue to do this by telehealth, it would be wonderful, because you can't get out and you can't do anything else. So it would be a great improvement for my quality of life if this could continue through telehealth.
So I put that in there because I said, because I really want you guys all to hear. You can hear me talk about access to care and payment and call this and call that, but that wonderful 80-year-old man, that's really why we advocate when we advocate, especially when it comes to CMS, is to take care of these people. That's what it's all about. So the moment that you're like, oh, I'm nervous, what do I do if I call? Will I say the wrong thing? Or what if, do I really, someone else can do it? Think about that man. Think about the people that you serve in the community. That's what advocacy is about. It's not about the money we're paid. It's not about how we're respected. It's about us being able to take care of people like that. So, I would encourage you all, we will be sending an email out tomorrow with more information about this, but by allowing us to provide telehealth now, it allows us to actually start collecting research, looking at the evidence, see how this can actually ultimately change the care that we provide and give us another medium. This is not replacing home care, outpatients, inpatients. This is by no means, but it's another way to provide access to care. And that could really actually change all of our futures. And we want to be able to do that and do a great job of it. So I will leave it at that. I'm not sure if anyone has questions now, or if Erin and Melissa want to wait till the end. I will leave it up to them, but thank you.
Thank you, Michelle. That was great. So if anyone has any questions for Michelle, go ahead and write them in the chat. Okay, I'm not seeing anything come up yet. So we'll definitely come back to that later too. As I said, we have the Q&A session built in at the end. So there'll be time. Think about your questions and write them down somewhere. So now I'm going to give a little update on all the legislation that's happening. I can share my, here we go. Okay, perfect. And okay, so this presentation comes right from the APTA. So it really, it outlines all the different work that they do. So to kind of just come up with that. So they advocate in a lot of different areas. They're in Congress. They're looking at advocating in districts and also in regulatory sessions. And their goals are really to help protect and promote the profession, ensure access, eliminate barriers, enact policies to empower healthy lives, decrease administrative burden, and provide transparency to patients. And they do all of this by meeting with legislators on Capitol Hill, going to fundraisers that are helped through the PT PAC, working with their political action committee, working with regulators at places like the CMS and the NIH, submitting comment letters, meeting with administrations, and working with coalitions of health associations. And really the work of our strong grassroots team from the APTA is how we get into a lot of those different areas. So to just start on all of these different things that the APTA is looking at right now. So the first one is the National Health Services Corps. And this is hoping to increase access for patients that are living in rural areas. And the added benefit of this one is that it also comes with the student loan forgiveness, and it can be up to $50,000 that a student can get their student loans forgiven if they become a part of this program. So adding physical therapy to this program has been something that they've been looking at for about 2 years now. I know we were really talking about it at the Federal Advocacy Forum last year. And they're continuing to push for it because they really feel that it's something that could be very beneficial to all students and just all physical therapists. So as you can see on the bottom, it has both a House and a Senate bill number. So if you're talking to any of our senators, representatives, asking them to support that bill would be very helpful. So the next thing that they're looking at is workforce diversity. And this is really looking at increasing the diversity of our profession and helping to decrease some of those barriers that people might have to becoming a physical therapist. So it's looking at different scholarships and stipends for people that meet different criteria and hoping to increase those accesses to care as well. So again, this has a Senate number. I have not seen anything about a House number yet for this bill, but if you're really into diversity and this is something that you want to focus on, this is a great bill, and it has a lot of really great implications for the future of both PT and just healthcare diversity in general. So something that I'm sure everyone has heard about is the 8% cut for Medicare. And we're really already doing a lot of work on this. As you can see, 10,000 members submitted comments against this ruling. So we're hoping to see something from that. I know that they haven't gotten a response that was very helpful yet, but hopefully soon. And they'll continue to push and make sure that, you know, we still get the reimbursement that we need so our patients can have access to the care that they need. So there's another bill looking at prior authorization, and this one is very interesting. It's really looking at decreasing administrative burden and also decreasing just the frustration that can happen when people are trying to get authorization for insurance coverage. And it hopes to start a online electronic way to look at authorization and see if what's the process, if you already have that, and what are the ways that you can go about it. So again, that works in that twofold way of decreasing the burden on therapists to have to go through that whole process and patients for having to wait and get bounced around on phone calls and emails. It's just hoping to streamline all of that. So as you can see, this one has a number in the House, and I really think this is a great bill to ask our representatives co-sponsor, and we'll go over a little bit on a nice, easy way that we can do that. It can be done in just a few clicks. So looking at PTs and community health centers, this is also something that came up with the Health Providers Corps, but just trying to get physical therapists as part of the providers that are covered in these health community centers. Right now, it includes a lot of different healthcare providers, but not PTs, which is really increases those barriers that some patients will have to physical therapy services because they're in areas that are usually, you know, decreased access, maybe more rural areas, or maybe areas that the socioeconomic status isn't as high and people don't have access to healthcare as easily. So having PTs and community health centers would be very helpful for those patients. And there's also a lot of implications with the opioid epidemic, which would be really great to help, especially within our state. So this bill is really great. So we want to look at the structure of the APTA. So the P team is one way that you can be involved. And it's a really great way of getting information from the APTA specifically about what's happening legislatively and being told how you can be involved. So they'll send out emails saying, oh, there's this bill that we really think, you know, you should let your congressmen or senators know about. Here's how you can do it. And they'll send you all the information right in an email. It's quick and easy. So if you want to join that, you can look it up on the APTA website. You just put in your email and you start getting emails. It's really great. Key contacts are another way that you can be involved. This is a little bit of a higher step, as you can see. And key contacts are really people that have a more personal connection with our local legislators. And they're somebody that the APTA can reach out to and say, we have this new bill or this new problem, this new stance that's going on, and we would really like you to talk to your congressman about it. And that way you can reach out to them and either get their thoughts or even get them in action for something. And then the Federal Affairs Liaison is someone who goes to the Federal Advocacy Forum and talks directly with our senators and representatives. And again, they have an even increased relationship with those legislators and are working directly with them. So all of those positions are open for people to be in. Key contact, PT, pretty easy to get in. The Federal Affairs Liaison is one person that we have every year, but if you're interested, I'm sure Michelle and the rest of the board would be very happy to hear that. So please reach out if anyone's interested in being involved in any of those at all. And then I also have, to go a little bit more over key contacts. So as you can see, 1 to 2 in each congressional district. They have those ongoing relationships with the members of Congress, and they are providing the information on those critical issues. And then they're keeping everyone informed, making sure to keep up those relationships and meeting with those members of Congress during that August recess, which is the time where they come back to our state and we can have face-to-face talks with them. So let's stop sharing for a second because I have. Does anyone have any questions at all about those? Here, so this is what I wanted. So I also have an update for our specific state legislation. You'll give me one more second. Here we go. Okay. Okay. So to talk a little bit more specifically about our state legislation. So the copay bill, which is looking at requesting copay and deductible parity with those primary care providers. We have it both in the House and the Senate. It was testified in hearing of the Health, Education, and Wellness Committee and then held for study. And then in the Senate, it's a waiting hearing for the Health and Human Services Committee. School-based PT, which was looking at getting rid of the need for authorization so frequently. In the House, it was referred to that same committee and it's a waiting hearing. And then we're looking at the same with the Senate committee. Imaging, which was a bill put forth to make sure that PTs can get imaging for their patients. In the House, it was testified on and then held for further study. And then the Senate, it was read and passed on the floor and then referred to the HW committee. The compact, which if anyone isn't sure what the compact is, that's the ability to be able to take your license to different states without having to transfer them there. So this was actually included in the governor's budget for this year, which was really awesome for us. We didn't have to put any legislation forward primarily. And then we just are remaining in contact with their staff and the Department of Health to make sure everything in that compact legislation goes up to what FSBPT requires and all those different requirements to make sure that it will be a functioning version of the compact. Because of the COVID-19 crisis, everything is currently on hold. So where all of our bills are, that's where they'll remain for the unforeseeable future. But our lobbyists are continuing to work. Our lobbyists are the May 4th group, and to just go over quickly, they're basically there, they're at the State House, they're in those committee meetings, and they're listening for us to say if our bills are being talked about or if there's any other legislation that's coming across that we should have our eye on, we could be interested in. So they're really working for us, and they've been very helpful with everything lately about telehealth and other PT considerations during these crazy times. So that is all I have as far as my update goes. When it says held for further study, Nicole asked a question about when it says held for further study, what does that mean? When is it going to be talked about? They were going to look at it and look at the implications, ask some other people like insurance providers, and then, you know, get back when the committee met again at a future time. I think now, because everything is not happening, it probably will be longer than they initially intended. So it could be next year or later this year. It kind of depends on when things get going and what they feel is important once they're back up and running in session again. Okay. Speaking of all of that state legislation, Jen was really awesome, and she's been to the State House to talk about those bills. So she's going to share that experience and how we can all be involved in those different bills and legislation committees.
All right, thank you, Erin. I just want to start out by saying thank you to Erin and Melissa for moving forward with this event in the virtual format. I give you guys a lot of credit for forging ahead. I think it's awesome that you're doing this. So I'm going to go ahead and share my screen, and we'll start talking about some legislative advocacy at the state level and some things that all of you can do to get involved. All right, so you should all be able to see my screen at this point. And I know many of you who are attending tonight. There's some of you who I don't know, so there's a brief introduction of myself. I've been a PT for about 20 years now, and practicing in the state of Rhode Island for about 18 years. And in terms of my personal journey with legislative advocacy, I've done my part in terms of sending lots of emails to my elected officials over the years about advocacy issues that are important to our patients. I've done that through the website, the advocacy platform in the APTA website, which is really wonderful. It wasn't until this last year when I got more involved by joining the Legislative Action Committee through the Rhode Island APTA, and what a phenomenal experience it's been. Really understanding in a little bit more detail how these things evolve from the grassroots, like Michelle was saying, and how they come to be, and what a difference we can really have by getting involved. So I'd just like to share some of my experiences with you, because if I can get involved on this level, then you guys can get involved on this level too. And students in particular, your voices are very important at this stage of the game and moving forward, because the legislative activities we're doing now are setting the rules for the future. So these are the rules that the future of PT is going to have to live by. All right, so starting just some overview of advocacy at the State House. So as we're advocating for things with our elected officials, we need to think about what motivates these elected officials. So first and foremost, what we hope and what I believe is that these elected officials are motivated by their intrinsic need and want to do good for the population. That's hopefully why they got into politics, because they want to make a positive change. And we also have to keep in mind there's probably a secondary goal that they'd also like to be reelected. So we have to keep that in mind. So playing that card also really fits right into what we're trying to do anyway. We're trying to achieve some sort of a change that's going to benefit our patients. That's why we are lobbying for something. And our patients are the very constituents that our elected officials serve. So we have to keep that message in mind as we're talking to the elected officials, and make sure that they're making the connection that what we want isn't just for us and our profession, but it's to make our profession better for the people that they serve. So our big goal is education when we're trying to lobby for something at the State House. So we need to educate our elected officials on what we do, on what the barriers are to what we do, on why making this particular change is going to be beneficial to the patients that we serve, which are, of course, the elected officials' constituents. So sometimes there might be a misconception that our elected officials are experts in all the things that we do, but by and large, there's definitely a void, and they're not always as aware of what we do as you might think. So as we look at how a bill is introduced and moved through the system, to be introduced as a new piece of legislation, we need to have some senator, some local Rhode Island senator, or some representative from the House side introduce the bill for us. So somebody, a representative or a senator, needs to be convinced that this is important. They need to sponsor the bill and bring it forward to be heard. So sometimes it can be difficult to get the ear of a representative or a senator, but that's where our lobbyists really come into play. And this is one of these situations, unfortunately, where it can be about who you know, and they know people. They know the right people, so that we can get the attention that we need and have a recognition of the importance of what we're trying to accomplish. So some of these bills can hit the floor to be heard. So once they're introduced, they need to be heard, not just, but they don't go right to the full House and the full Senate. They need to be heard at the committee level first. And this is kind of a screening process so that there's not a gazillion bills that go right to the House and Senate floor. So you see the listing of committees here, and the committees are kind of grouped by different topics. So health, education, and welfare, that's where most of our bills are initially being heard when they are presented, and that's on the House side. And then the Senate Health and Human Services Committee is on the Senate side. So earlier I mentioned that our senators and representatives aren't always so well educated and knowledgeable about what we do in our profession. So as you look at this and say, oh, it's the Health, Education, Wellness Committee, they must have a good idea of what we do. But these health and education committees here, there is all sorts of healthcare, it's all sorts of education, the public school system, every school issue gets heard by this community, this committee. In terms of welfare also, lots of different services fall into that realm. Farming and agricultural services fall into health and welfare as well. In fact, one of the PT bills that was just heard right before the State House closed down because of the crisis, there was a farmer testifying and explaining why he should be able to sell pickles at his farm stand, and who knew it was illegal still to sell pickles at a farm stand. But that I give that example so you understand the breadth of things that these committees are dealing with. It's not just healthcare. So we really do need to educate them and assume that they don't really have a good starting point to understand where we're coming from and why what we're asking for and why not having what we're asking for is a true barrier to providing service. So once these bills are introduced by representative or senator, they're heard by the committees. If they pass in committee and the committee feels that there's merit to the bill, they will then elect to send that bill up for a full vote at the House and the Senate. And in order for a bill to move forward and officially be passed, it needs to be voted in by the full House and the full Senate. So that's kind of how it moves through the system. So there's some challenges also. So, you know, I need to present all sides of things. I want you guys involved and out there and talking to your senators and representatives and advocating, but we need to be mindful of what the challenges are so we can tackle those kind of head on. So in terms of testifying at the State House, sometimes there's a short notice for hearing dates. Usually what happens is the bills are introduced with the House and the Senate in beginning of the year, like January, February time. And then for the rest of the spring, every Friday, the House and the Senate will list for every one of those committees that we looked at, they'll list all the bills that are going to be heard by these various committees in the following week. Right, and every week the committees hear a new set of bills, but we never know when the bills that we brought forth are going to be scheduled. So on Friday night, they release the bills that are going to be heard at the meetings the following week. So it's always less than a week's notice. But if you know you have a bill in, you have to be watching every Friday night to say, okay, is it gonna get heard next week? And then hopefully be ready to go and attend the hearing. So hearings can sometimes be lengthy. So you should know that going into it, that there's a lot of bills that are heard by the committee every time that they meet. And we don't always know what order they're going to be heard in. And once we get there, we have to sit through all the other bills about pickles and education and anything else that's going on before we get up to have our case heard. So again, something you need to be prepared for going into this. and there's going to be questions. So as we're providing testimony, it's the politicians' responsibility really to make sure that they're wrapping themselves around all facets of the thing that we're asking for, balancing the risks with the benefits, and because they're not always fully educated on the topic, they're going to have lots of questions for us. So that's something that we need to be prepared for. So keeping those challenges in mind, I wanted to show you a little video clip from the Senate Health and Human Services Committee meeting on at the end of January. And I attended this one along with a number of other PTs and our lobbyists from the May 4th group. And we provided testimony for the imaging bill to allow PTs to order x-rays. So again, wanting all of you to get involved with these sorts of activities, I wanted to show you a little video clip of what it's like when you're actually there giving testimony. So it kind of demystifies the process and hopefully makes you realize that this is really something that you can actually do. So the full hearing video is kind of long. So it's about a 2-minute video. I took little sections of it and strung them all together. So what you're going to see is you're going to see the lobbyists from the May 4th group introducing the bill, and then you're going to see Greg Doucette, who's a PT, who was the first one to testify. And I'll show just a little bit of his testimony, and then I'll show an interaction that he had with one of the elected officials who had a question. So here we go with the video.
So we're going to start with 2066 by Senator Lombardi. Which is about physical therapists ordering diagnostic testing. And the first, we have testimony from 3 people, all in favor. The first is Rick McCullough. Thank you. Welcome. Go ahead.
Thank you, and I'll be very quick. You probably remember this bill last year. This was a bill that the Senate passed and sent over to the House last year. Unfortunately, because of the hasty ending of the House bills last year, it did not get heard. But let me just be quick. There's physical therapists. I can explain this a little bit better. But
thank you, Greg. Go ahead.
Good afternoon, ladies and gentlemen. My name is Greg Doucette, and I'm a physical therapist and an orthopedic clinical specialist. I live and practice in Warwick. I'm also a member of the board of directors of the Rhode Island chapter of the American Physical Therapy Association. And I'd like to begin by thanking this committee for the opportunity to speak to you today. I also want to thank Senator Lombardi in particular for introducing and supporting this valuable piece of legislation concerning a very important issue that currently limits access to quality health care for the people of Rhode Island, its patients. For example, in the current system, if I have a patient who presents to me who I deem requires an imaging, it requires me to, 1, refer that patient to their primary care physician or a medical doctor, 2, have them obtain that appointment, 3, have the imaging occur, 4, have them follow up again with that medical professional before 5, we can start the treatment. That process, under ideal circumstances, takes 2 to 3 days. Typical is closer to 5 to 6 days, and unfortunately can be as much as 2 weeks. In that time, the patient is suffering with pain or worse, likely using pain medication like opioids to manage symptoms, and we're all acutely aware of those dangers. And they could potentially be missing work, unable to care for themselves, their families, their children, and their quality of life is compromised if not eliminated. Worse still, because of the multiple medical visits, the patient and the healthcare system will unnecessarily incur significantly greater costs.
And I just wanted to ask, when you had mentioned in regards to school, did I understand, is everyone coming out of to be licensed doctor out of the program now?
So as of right now, Rhode Island licensure requires a master's degree, but there are no master's degree education programs to be found any longer. Every program in the country is a doctorate program.
All right, so that gives you just a feeling for how it goes when you go to perform or give a testimony at the State House. So this is something that all of you can do and all of you can be involved with, and you get to be on Capitol TV. So little bonus there also.
So we're going to start with...
All right, so we're going to go forward. So some tips for testimony. So should there be a bill that you're following, you're interested in, and you find out there's going to be a hearing and you want to go and you want to provide some support. So usually we have only about 2 or 3 people max providing testimony. The meetings can be lengthy. There's a lot of bills to be heard. We want to be clear. We want to be succinct. We don't want to overwhelm the elected officials with too much information. So 2 to 3 people max to be succinct, present them with the evidence they need. And bring notes, but don't read them. So what you want to do is to have done all your research ahead of time, have your notes with you, but really, make eye contact and talk to the elected officials as you go through your speaking points. So if you do want to get involved, but let's say you don't want to jump in and provide testimony right away, there's definitely other ways to advocate at the State House. You can simply attend the hearing and sign in favor. When you arrive at the hearing, they will ask you, are you in favor? What bill are you here to support or not support? So we would say, oh, the PT diagnostic imaging bill. And they would say, are you in favor or not in favor? So you sign in favor. So there's power in numbers. So simply by showing up, signing in, saying that you're in favor for the bill, that you're sitting in the audience, the elected officials sitting at the table, they have a list of all the people who have turned out to be in favor of a certain bill. And again, you are their constituents. They're serving you. So when we turn out in numbers and they know that this is something a lot of people want, that's going to be very influential to the elected officials. You can submit written testimony. So if you don't want to go and speak, you can show up at the hearing, sign in favor, and say, I provided written testimony, and hand it over, and that will get distributed to the elected officials. And you can obtain letters from stakeholders or constituents. So there was another bill that was recently heard on copay equity, and I was able to work with some of the PTs at our private practice to get a letter from one of the patients saying why paying such a high copay was a hardship for her. So the elected officials really like to hear from the patients. Again, they're the constituents, so if their voices are being heard saying, I know this bill is up, this is something that would really be meaningful to me to see action being taken on, then that's meaningful to the representatives and the senators. And if you can't attend a hearing and do any of these things, you can always email your regional senators and representatives saying, I know that this bill is going to be heard, and here are my thoughts on that. Here's why I think it's important. All right, so that's it in terms of advocating at the State House. And again, I just encourage all of you to get involved, have a voice, and put yourself out there, because what we do now, again, will make a big difference, not only now, but into the future as well.
Awesome. Thank you, Jen. Definitely a great overview of how we can be involved at the state level, which is so important for us. This is where we're practicing, this is where we're living, this is where our patients are coming from. So definitely something that's really great to get involved in. And as you showed, there's so many different ways. So very accessible for everyone. Okay, so next we're going to hear from Nicole. She is our Rhode Island delegate for the House of Delegates. And she's just going to tell us about that whole process, what the House is, and how everything works.
Thanks, Erin. Okay, can everyone hear me okay? All right, perfect. So, yep, my name is Nicole, and I'm currently serving my second year as the delegate for the state of Rhode Island. So I do want to apologize ahead of time. There's a lot of information I'm going to be throwing out your way. So if at any point throughout this presentation you have a question, feel free to ask. If not, I'm going to allot some time at the end too with my personal direct contact information. So if you have any questions as well. Okay, so what exactly is the House of Delegates? So the House of Delegates, it's an APTA policy-making body. It's comprised of voting chapter delegates and non-voting delegates. So some of the non-voting delegates consist of the Board of Directors, which has 15 members, 6 officers, and 9 directors, section members, assembly, and PTA caucus members. The number of voting chapter delegates is determined each year based on the membership numbers as of June 30th. So last year we had 404 voting delegates. The state of Rhode Island has 2, one Chief Carroll, and then myself is the other delegate. We also have a PTA caucus rep as well. So business for the House follows parliamentary procedure, and it's conducted through introduction of delegate proposed motions, which may be amended APTA bylaws, direct a course of action, articulate an association attitude on the physical therapy needs of the public or the needs of the members, or describe a goal the association wishes to achieve. So what does all of this mean exactly? So that's what I'm going to try to explain as briefly as possible going forward. So the House of Delegates allows for the ability of those with differing viewpoints to come together, discuss and debate an issue in a place that allows for the majority to rule, but which requires the rights of the minority to be protected. So it operates according to bylaws, which can only be revised, known as amending, by giving notice and by a 2/3 vote of the body. It must follow special rules of order, and the parliamentary authority. I'm going to focus today on Robert's Rules of Order. So these rules enable the overall membership of an organization to establish and empower an effective leadership as it wishes, while also retaining exactly the degree of control over its affairs. So still confused, kind of think of it this way: as sporting events have rules and referees, the House of Delegates has Robert's Rules of Order and parliamentarians. So ultimately, it's the majority of the delegates in the House who decide the general will, but only following the opportunity for a deliberate process of full and free discussion. So here are some of the parliamentary procedures of the basics of Robert's Rule. There's a lot listed here today. I'm just going to focus on the main motion and just kind of briefly touching upon subsidiary motions, privilege motions, procedure for handling a main motion, and some forms of voting, which we'll see in the virtual House. So about a main motion, business of the House, it's conducted through the introduction of motions. So these different types of motions may amend APTA bylaws, direct a course of action, articulate an association attitude on a physical therapy needs of the public or the needs of members, or describe a goal the association wishes to achieve. A main motion, if it's adopted, becomes the official recorded statement of action taken by the House. And these motions are developed by delegates and reviewed by the reference committee before being published in Packet 1 in late April. I also provided a link at the end for Packet 1. Motions may then go through numerous revisions before being voted on the House, including potential revisions during House discussion. There's also a link here for the APTA policies and bylaws. So a main motion, in essence, introduces new business. It can be seen as rescind or amending something previously adopted, adopt recommendations of a committee, or a charge to the House. So a main motion requires a second. It's debatable, it's amendable. The vote on this motion can be reconsidered, and it requires the majority vote for adoption. Some of the exceptions are main motions that require a 2/3 of the vote, which consists of motions to adopt or suspend rules of order, amend something previously adopted without notice, or amend bylaws. So Packet 1 released this year consists of 40 RCs. This is a significant change from last year, which consisted of 70. There are 9 RCs here that are amending bylaws. So I'd like to review this chart so that everyone can fully understand how the packet is broken down. Being able to understand the packet in all of its entirety is how everyone can help as a member in our profession by voicing their agreement or concern at the caucus that will be held by myself and Carol prior to attending the House of Delegates. So if you look on the left-hand side of the column where it says RC with the number, all of the 40 RCs are numbered with the dash of the year. So you can see the first one is 1-20 to indicate the year in which that was developed, and it has amend. To the right under contact, that is who developed the motion. So for the first one, FL, that would be Florida developed that one. For the second one, the BOD would be the Board of Directors. For the last one, the SCB, that would be the Special Committee. And the page is where it can be found in the packet. So there are 3 basic processes of amendment. They are the first, to insert or add a word, 2, to strike out words or a paragraph, and 3, to strike out and insert or to substitute. To strike out and insert applies to words, to substitute applies to striking out the entire paragraph. Here are just the remainder of the amendments. And I wanted to provide an example. So from packet 1, I provided the example of RC1. And so this is the amending for the bylaws of the American Physical Therapy Association to grant life members the privilege of serving as delegates to the House of Delegates. So here we can see that it says life and life physical therapist underlined. So that would be an insertion. On line 29, it has the word and crossed out. So that would indicate it's being taken out of the verbiage. In this example, there are no substitutions taking place in the bylaw. So to move on, these RCs now are looking at adopting. So some of the ones that chapters would like to adopt are the role of PT in sleep and mental health care, and adopting financial transparency with the CAPTI accredited programs. So I pulled that example here. So everything underlined, this is new. The most important part here to note is SS all the way down the bottom on line 30. That stands for support statement. So this statement is the maker of the motion's clinical decision behind making that motion. So that way when you're reading it, you can see the viewpoint as to why they wanted this motion created. This next here in the packet, there are 6 RCs in total placing a charge to the House. So this one right here, oh, sorry, the last one was on sleep health. This one is the charge from the student assembly. So I chose this one because this was a charge from the student assembly. So up at the top, it will require a majority vote. And you can see, okay, it was proposed by the Arizona chapter and the student assembly in bold. That's everything new they're adding. And then here's their support statement. So the support statement is pretty long. This support statement continues until page 134, and then it's followed by references. So if anyone has any other questions regarding those packets at the end, I can definitely answer those questions, and I could provided a link too. So moving on from some of the main motions, I also want to touch upon the subsidiary motions, and these assist the assembly in treating or disposing of a main motion and sometimes of other motions. So I listed out some examples here. We don't have to worry about going through them. This is a chart that was taken from packet 1 that helps describe in detail each form of the subsidiary motions that take place during the House. One of the main things is procedures for handling a main motion. So this is when the delegate obtains and assigns the floor. A member rises when no one else has the floor and addresses the chair. The chair recognizes the member by announcing his name or title. So last year we were provided remotes at our station, and a delegate could nominate themselves to the floor, by then which the Speaker of the House announces that in order taken from the devices. So I'm unsure how rising to the floor will occur this year, but to be determined with further information. So how the motion's brought before the assembly is the member then makes the motion. I move that. Another member, without needing to rise, seconds the motion by stating, I second the motion or second. The chair states the question on the motion. It is moved and seconded that. Members can then debate the motion. So before speaking in debate, members obtain the floor. The maker of the motion has first right to the floor if he claims it promptly. All remarks must be addressed to the chair. Debate must be confined to the merits of the motion, and debate can be closed only by order of the assembly or by the chair if no one seeks the floor for further debate. So the chair puts the question. Also puts the question means putting it to vote. So the chair will ask, are you ready for the question? If no one rises to claim the floor, the chair processes to put the question. The chair states the question is on the adoption of the motion that, as many R's in favor say aye, those opposed say no, and the chair announces the result of the vote. So while doing a voice vote, although it's the most commonly used form of voting, sometimes it will sound a little unanimous. So rather than going from saying aye to no, it will go to a rising vote. So this is used to verify a voice vote, and it can also be, it's done by saying rising up, so all the members will stand. And so it's done visually by looking at who's standing. It can be ordered by the chair or a single member who calls for a division of the assembly. The third one is a counted vote, so it's the least used. It can be ordered by the chair or ordered by a majority vote of the assembly. Last year, the only time that we were called to do a counted vote was when there was an RC on medical marijuana. Okay, so just some of the logistics of the House. The Speaker makes an attempt to alternate debate between opposing viewpoints so that discussion can flow and all viewpoints be heard. For most motions, a majority vote of those present is necessary to adopt a motion. Some require the 2/3. If adopted, this motion becomes an association position, policy, guideline, or standard. If the motion is defeated, the next order of business is taken up and the process begins again. So in addition to the main motions and subsidiary motions, there are also privilege motions. Privilege motions, they deal with special matters of immediate importance, and they do not relate to pending business. Some examples are just calls for the order of the day, recess, adjourn. All of this is conducted by the House Speaker. However, it is important to be aware of all these procedures. So if you do indeed want to be present on the virtual House, you're able to kind of follow along with everything happening. Last but not least, elections for the national office of APTA do take place the first day of the House. These elections are filling the board of directors and nominating committee. This year, the positions available are treasurer, speaker, the three director positions, and 2 nominating committee positions. I put on there the link for all the candidates with their bios, and all of the information can be accessed through all APTA members on the community hub. So again, there's the link for the community hub as well. So unfortunately, due to the pandemic, we will transition to a virtual format, which will be June 1st to 3rd. Details are still yet to come out, so I'm sure that we'll be able to forward those out to everyone once they come. But in the meantime, the speaker did advise to continue using the House Hub and consent calendar. So the biggest way that everyone can be involved with the House of Delegates is participating with the Rhode Island Caucus, which Carol and I still have to come up with the date for which we will host that. And that's when everyone comes and voices their opinion on Packet 1, which consists of all of the 40 RCs, for whether or not we would like Rhode Island to take a vote of, yes, we would like to go to the House of Delegates and vote in favor of this RC or oppose the RC. So with Rhode Island being such a small state, everyone's opinion truly, really matters in this. So here is the link for Packet 1, Chief Delegate of Carol Petrie, myself with my email on there. So if anyone has any questions, I'll just stop sharing my screen to see. Okay, well, I don't see any questions coming in this time, but please feel free to email me and we'll be in touch with when the Rhode Island caucus will be taking place. So sorry, a lot of information in a short period of time.
Oh, Nicole, we have a question from Janice.
Oh, okay.
Yeah.
If the
so Janice is asking if it's virtual, do you think there will be an opportunity to have an audience and for the general public to view?
Well, normally, even when the House of Delegates is held in other areas of the nation, there is an option to go on and view virtually. So I think we'll still be able to do that, like while it's occurring, if that answers your question.
Okay, great. Thank you very much, Nicole. That was an awesome overview of the House of Delegates. And to just quickly talk about student involvement, I was able to go last year, and I was actually able to be what was called a special assistant to the vice speaker, which sounds like a lot, but I was timing people. But it was really interesting to be able to see the process. I was right there on the floor. I was actually on the stage, sitting next to the speaker as she was going, and the vice speaker as he was going through the processes of everyone putting in that they want to talk on different motions. So that's obviously not happening this year, but next year, hopefully they'll be able to have an in-person house and there'll be opportunities again for students to be involved that way, which was really awesome. But there's also just the ability to be involved in the conversation. There's something called the Student Network that is being moderated by our Student Assembly Representative Mitch Lane, and he sends out emails asking for input on the different motions. And there's a lot this year on student debt, so I would highly encourage students to be involved in looking at those if you can. Okay, so next Melissa is going to go over some of the ways that we can be involved and different things that you can get involved in advocacy.
Okay, thank you, Erin.
Yeah.
Go ahead and share. Okay. So for those who don't know me, I'm Melissa. I'm a second-year student at URI, and I'm the core ambassador for Rhode Island. So I'm going to talk about some advocacy opportunities. COVID changes some things, and it changes how our efforts are going for 2020, but there's still some things we can do remotely. So traditionally, a great way to get involved was to invite your legislator to your school or your practice. It's a hands-on way for them to learn what life is like for a PT and see firsthand the challenges faced in their life and gain knowledge of the issues. And with this, you can educate the lawmakers on the issues, get others involved, and if a legislator doesn't know how PT works, how can they know how to help? So during stay-at-home orders due to COVID-19, these visits are still possible as long as they're held remotely. Demonstrations or education on Zoom can still be an effective way to continue advocating to legislators while social distancing. This is also an excellent opportunity to maybe show legislators how physical therapists are using telehealth through a video call. It's a great way to advocate for the PT's ability to bill CMS for telehealth codes. It's easy to set up. You call the legislator's district office to schedule a virtual visit during a congressional recess. So what are some other ways that we can advocate? Okay. So we can educate our legislators on physical therapy. We let them know what you do. Many people, legislators included, have a general idea of what PTs and PTAs do and what PT school is like. We all know it's much more than that. If legislators don't know what you do, they don't know how they can help. Hosting a remote visit with legislators is a great way to educate them. Build relationships with legislators for short and long-term APTA initiatives. Advocacy is a marathon, not a sprint. And if we are expecting to get everything done overnight, then we will definitely have to take a step back. Advocacy can take a long time, and we must be persistent, patient, and persuasive. You are an important part of APTA's advocacy structure because you are the constituent and they work for you, and you're the expert. So how can we get started? So this one's for the students. The Student Advocacy Challenge is a great way to get involved because there's a menu of activities to get started. Even if you have never been involved with advocacy, there are simple tasks you can complete for points that teach you how to advocate. So how it works is the schools compete against each other by completing a variety of advocacy activities. Students will report their activities and earn points for them, and then the winner receives a visit to their school by the APTA staff or a board of directors member, and you can learn more at this website. The APTA Action app. So APTA makes it easy to advocate with the Action app. It's available for Apple and Android. On the app, you can contact your members of Congress, donate to the PTPAC, look up talking points on top issues, which are especially handy for legislative visits, and find out who your members of Congress are and learn more about them. And the best part is it's easy to, and it takes only a few minutes to take action. There's some other resources about how to raise our voice. So this kind of goes along with Michelle's homework for us to contact our senators. We can contact our legislators on the APTA website. So the Legislative Action Center on the APPA's website has different letters you can send. The center is updated with the latest issues and gives you pre-populated letters that go directly to your legislators. So if you look to the left, that one's for us, for APPA members. And then for patients, they can look to the right here, and they have a different portal on there that helps them advocate too. Okay. The PTPAC, it's a sole fundraising organization that provides access and influence of legislators to champion PT legislative interests at the federal level. Donating to PT PAC is another way to get involved. For a $20 donation, you can become a student star, which counts toward the Student Advocacy Challenge, plus you'll receive a label pin. And since 2020 is election year, your donation is even more important. You can visit the ptpac.org website to learn more or donate through the APTA Action app. Please note that you must be an APTA member to donate. Thank you. We appreciate you being a part of this program because together we're stronger and we can better the profession of PT together. And thank you so much for tuning in tonight. We think that the current situation added an interesting, unconventional spin on things. So we're really happy that you guys tuned in and learned a little bit about what's going on right now with us.
Yes, thank you guys so much for coming. So we are going to take questions in a second. First off, I just wanted to say, I think I forgot to introduce myself at the beginning because I was so eager to get going. So in case you don't know me, my name is Erin Sales. I was formerly the Core Ambassador for Rhode Island. I currently serve as the chair for the Advocacy Project Committee for the Student Assembly of the APTA, and I am about to be a new grad of URI. So, like Melissa said, thank you all for joining us. I do want to apologize a little bit. I had a little Zoom snafu. The first presentation that it shared when I went to mine was an older presentation, had a little bit of missing information on my title slide, my bad. But the one that we will send out, and we will be sending out all of these presentations in case you missed something or you want to look back on something, everything will have all the information that you need. If anyone has any questions, please, turn off your mic if you would like to do it that way, or write it in the chat. We have some time now to do that. There is a way to you can either do like the little check yes if you see that, or there's also a way to raise your hand. I think reactions, there's a way to give a little thumbs up or something. So if you want to kind of alert us that you would like to ask a question.
Hi everyone, Lori Miner. Great job. Sorry I was late. I had another Zoom meeting, but I'll watch the video. Did everyone hear that CAPD sent out another update yesterday that telehealth will be allowed for ClinEd as long as good, you have heard that. All right, as long as the
I did see that.
Department feels comfortable and the PTs doing that as their regular patient visits. So that was good news. That's something, a new development. Good.
Yeah, I really have to thank CAPD for being so on top of everything. They've made it a lot easier for students, and I'm sure administrators as well.
I'd love to speak to that a little bit. So we have a national task force that is working on telehealth for not just now, but in the future, and involving CAPD in that, involving what should we pull us in, how do we get CAPD to ensure that this is involved in curriculums, looking at how we take existing clinical practice guidelines and that have already been created and how we incorporate telehealth in those or not. Because one of the concerns is, although it's this time where we've got telehealth being utilized in lots of different settings, there's such disparity in what that looks like. It's all over the place. Some of it's amazing, some of it's not. There's different thoughts. So there's definitely a discussion going on with APTA nationally and this group that I'm involved with about how do we ultimately sort of reel it in and say, this is what a telehealth visit looks like, and then how does it fit into what we're doing. So we're looking at starting and being involved with research on this from a clinical standards aspect, looking at the outcomes. I mean, it's a very new area, but also how do we ensure our students get some training on it, and what does that look like? So there's a huge amount of unknowns. So talk about grassroots. And I think it's really exciting for the students and the next generation, because you're suddenly coming into this era where there's this new mode of delivering care that there really is no research on about the effectiveness or the standards or the what it's like, what does it mean to provide telehealth. And so there's going to be a lot of work that needs to be done and done right to make sure that we don't just sort of, we just have to be really careful with it to ensure that the standards and the quality are where they need to be. So there's a lot of people involved, and I just think it's a really exciting time for the PTs and for the students. As you come through this, you're going to have to be very involved with it and aware of the standards and looking at the research and looking at the outcomes. We will need to be.
Yes, thank you. And I have to say the resources that the Rhode Island APTA has been putting together on that COVID page that you have on the website is really awesome and really helpful. And I've definitely looked at that a time or two to start looking at some different webinars I can look at and just articles that are being put out. So yes, definitely a huge resource for us to use.
Thank you, Erin.
I know, I love how we can go to the Rhode Island APTA website as a resource page. So that is great.
Oh, you just made my day, Nicole. And that's our kind of goal, is that we can turn it, and we want you guys, we want everyone to be like, oh, where's a trusted place to go to for the most up-to-date information? Oh, I'm going to go to APTA Rhode Island, and obviously APTA National as well. But we've really tried to make a concerted effort to pull in information for considering every kind of clinician or student, no matter what kind of setting, to make sure all the sort of key resources are there. And some of it we've developed on our own, and obviously a lot we pull from PPS, APTA, cardiopulmonary, home health, pediatrics. We've really we're trying to pull it all together. And what we, I don't want to get off track, but at this stage, what we continuously look for is feedback from people in different kinds of settings to try and understand, like, what do people want in the months to come? Because remember, we're a membership-driven organization, and we're here to serve the members and the people out in our communities treating patients. So getting feedback about what people want and need is really helps us drive the content that we put out for people.
Okay, so I'm not seeing anyone putting any questions in the chat at all. Of course, if you have any, everyone's contact information will be on with their presentations on that email that we send out. So feel free to contact anyone with any specific questions that you have. Thank you all so much for joining us. Again, we really, really appreciate it. We were a little unsure how this virtual thing was going to go, but I think it went pretty well. Thank you to all of our awesome presenters. You guys did a great job. And just thank you, everyone. Hopefully you know a little bit more about advocacy and what you can do to be involved and are looking to do something. And Michelle gave you some homework to do, so do it.
Michelle, you're muted.
I'll unmute myself. I will say this, I have recorded this, so it will come out in a newsletter, so please feel free to share it, especially with your students or anyone interested in advocacy. I mean, the information that came out from Jen and from Nicole and Melissa and Erin is really an amazing way to get an understanding of what advocacy is about. So we will be sharing it through a newsletter. And again, the more people we can get involved, the more of a difference we can make to help the access of care for the patients that we serve.
Okay. Well, again, if anyone wants to ask any questions or just come on and talk, please feel free to. I think we'll be here for a little bit longer, but thank you so much for joining us, and I hope you guys have a great rest of your night.
Thank you, Erin.
Thanks, Erin. Thanks, Melissa. Great job.
Great job,
Thank you,
everyone.
Jen.
Thank you, everyone.
Have a good night.
Good night.
Bye.
Good night.
you. I stopped recording, and I'll send this recording over to Tamara so she can push it out. But if you guys want to stay for a moment, you guys were awesome. I know it's very hard presenting virtually, and I'm not sure how much experience you have with it, but it's very different compared to doing it in front of
It
audience.
is.
You guys
It
were
is
both
different.
great.
Thank you. I was
No,
so,
you-
when I like started my thing and I saw that it said like your school name here, I was like, oh, it's like I made sure that I changed that on mine. And of course, the one that gets shared doesn't have that.
Here's the thing. I think this is the beautiful thing about this time, and that's we're kind of, I almost kind of like it. Like we have no choice, but we're all a little bit more authentic and human. And like, it's, you know, the fact that you had that up and it doesn't have your name on it is kind of like big deal, man. Like, it's not a big deal.
Yeah.
Now, maybe maybe a month ago, you would have been like, oh my goodness. And maybe your professor would have been like, Erin, you should have checked this and that, you know, but right now it's like, you know, it's not a big deal. And that's kind of nice.
Yeah. Yeah. I was actually talking about that with somebody the other day because they were talking about how they came into a position in their student SIG board, and they're like, I always had to do everything like perfect. And I was like, oh, I let that go so long ago. Like, you could tell you, because no matter how hard I try, like, this is a prime example. I like had my thing, I checked it, I tested it, I was ready to go, and then whatever happens, happens. And I'm like, sometimes you just roll with the punches and keep going.
Refreshing, because it makes you be like, well, you know, at the end of the day, we're all human, and if someone's perfect, it's all an act anyway. Like, it's just the reality. We're all trying to, I mean, as long as you're prepared, and you guys were beautifully prepared, you spoke great, you delivered wonderful information, and it's all right there. Yeah, it's really great.
Oh, thank you, Michelle.
Yeah.
So good job. So I appreciate this will only take a few minutes, and what I'll do is record it. But what we're really trying to do is get these sort of little, you know, only 2 to 3 minutes. But we're, you know, I'm thinking of it like almost faces of Rhode Island physical therapy through the COVID and pandemic. And we'll push it out to members each week. We want to push it out and have like a new one each week. But I figured because you guys are doing this, and we'll put out this newsletter that has a recording to the whole series, as well as encouraging people to reach out to Senators Whitehouse and Reid with what I talked about. But we'll do, you know, just getting a little bit of feedback so that the everyday PT who's out there, who doesn't even think about the students, gets to hear what you guys are dealing with. And just like in another week, they'll hear, oh, the physical therapist who's working in an ICU who's dealing with stuff. And you're like, whoa, that's very different. And then you'll hear about the private practitioner who's dealing with telehealth. And then you'll hear about the other one who's dealing with patients coming in, and how do you figure out who comes in. So I think it'll just be a nice way to build our community and build, you know, continue to build respect for the fact that it's very easy for us as PTs to get siloed. I'm like, I'm a student, or I'm a private practice, or I'm hospital, or I'm pediatrics. Where at the end of the day, we want to think, no, we're all physical therapists, and maybe we're in different settings or with different populations, but it doesn't mean one's better than the other or you value more than the other. We're all sort of doing the same thing. So I'll give you a little scoop before we record this. So I would love to, you know, first of all, what I'll really say is Melissa Franco is just let me make sure I get this right. Second year student at URI. Erin Sales is third year student in her final year, was just finishing up her affiliation. We're here today to talk about COVID-19 and the impact that that's had on your guys, your spring, basically. You know, my first question would be is, how has the COVID-19 impacted you as a student? And then basically it's up to you to say, you know, how did it impact your classes, all of that. So I think be authentic, be real, be honest. The next question I have is, you know, what are your biggest fears or concerns at this stage? Like, you know, and maybe I'll piggyback off it and say you're worried about job. I mean, I'll hear what you guys have to say. I'm not sure what your biggest fears or concerns, so I'd want to hear that. And then what have you learned through this? So, I mean, that's something that I think it made, just to give you a little hindsight, like if you suddenly, someone made you stand back and think like, let's think about big picture. What have you actually learned through this? And maybe you've learned that life sucks, or you can't stand being without your classmates. Like, just be real. You know, maybe you've got something profound to say, like I've learned how much I love my class, or I love treating patients and how much I miss it, or whatever it is. There's no right or wrong answer. It's just like, be whoever you are and say that. And then I'd say any other thoughts or pearls of wisdom or advice that you would have for other students, because I'm sure other students will listen to this.
Okay.
Any questions? Okay. Sound good?
Sounds good.
That sounds good.
Well, oh, we've been recording the whole time. All right, we're going to stop. I'll stop recording and then I'll start again just to make it easier.
Okay.